Many Americans will experience back pain at some point in their lives. Sometimes it's just tight muscles that need to be stretched out, but in other cases, it may require surgery.
Local 5's Alexander Burnley introduces us to an Aurora BayCare Medical Center patient who underwent surgery for his back pain and actually regained his mobility.
Bob Boerner is like many Wisconsinites. He spends his time outdoors and loves to hunt and fish, but his back pain was debilitating and even walking became too difficult for him. Then he went to Aurora BayCare Medical Center's Spine Center and got his life back pain-free. Bob Boerner says his back pain became progressively worse over 3 years.
I'm an outdoorsman. I coached for a lot of years, coached wrestling, so my body took some wear and tear, and within the last couple of years I noticed I began to quit walking. When I did walk, my back hurt, and then it just got worse and worse until I couldn't even stand like we're standing right now.
Dr. Richard Harrison, a neurosurgeon at Aurora BayCare Medical Center, says we can become more susceptible to back problems as we get older.
Most commonly, it's a degenerative problem as we age.
Dr. Harrison says surgery was the best option for Bob.
His joints were overgrown, he did have some discs that were bulging out, and one bone was slipping forward on another. So we were able to employ some modern techniques with a fairly small operation to decompress and stabilize that procedure. We have some intraoperative imaging techniques that aid in the safety. We have monitoring of the nerves that aid in the safety of doing these surgeries. It's still spine surgery, so there are risks, so we want everything in your corner when you're doing these kind of things.
Aurora BayCare recently received the DNV GL Healthcare Spine Surgery Program certification.
We have neurologists, we have monitoring that we do with the surgeries, we have extensive therapy, both physical and occupational therapy that's important in patient recovery, in addition to very experienced surgeons, dedicated neuroradiologists, and the latest equipment.
Post-surgery, Bob is back to doing the hobbies he loves, pain-free after a short recovery.
I woke up in recovery and thought, I'm lying on my back. I haven't done this for 3 months. I was up and walking the same day, that evening in the hospital. I walked quite a bit the next day with a walker, of course, and I was out of the hospital the day after.
Dr. Richard Harrison at Aurora BayCare Medical Center says it's best to work with a neurosurgeon when considering a spine operation. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Alexandra Burnley, Local 5 News.